Let us begin by exploring what evidence-based practice, or EBP, means in the context of modern nursing care. EBP is not simply about using research findings. It is a systematic process of integrating the best available evidence with clinical expertise and patient preferences to inform our decisions in our practice. Think of this as a three-legged stool. One leg is high-quality research evidence. One is the nurse's clinical judgment and expertise. And the third is the patient's own values and life contexts. All three must be balanced for care to be truly evidence-based. Through this process, EBP enables us to make informed clinical decisions. These are decisions that are not based on tradition, habit, or anecdotes, but grounded on evidence and aligned with a patient's virtues. Ultimately, the core goal of EBP is to improve health outcomes. We aim to provide care that is safer, more effective, more person-centered, and more aligned with the latest advances in science and nursing practice. EBP allows us to continually evolve our practice, ensuring that we meet the needs of today's patients, not yesterday's assumptions. The effectiveness of EBP depends on four key components, which together create a strong foundation for evidence-based decision-making. First is the best available research evidence. This is not just any article we find. It must be rigorously designed, critically appraised, and directly relevant to our clinical question. Systematic reviews, randomized controlled trials, and high-quality observational studies are examples of evidence we highly value. Second is clinical expertise. As nurses, we bring years of education, training, and practical experience to the bedside. We must interpret the evidence in light of our patient's unique situation and our own understanding of clinical realities. Evidence alone does not dictate care. Our judgment remains essential. Third, we must always honor patient preferences and values. A treatment that is effective in the literature may not align with a patient's cultural beliefs, lifestyle, or goals. EBP requires us to engage patients in shared decision-making and respect their autonomy. Finally, the clinical context matters. The best evidence cannot be applied blindly. We must consider the setting we work in, the available resources, the organizational culture, and the broader healthcare system. Successful EBP adapts evidence to context, not the other way around. Why do we emphasize EBP strongly in modern nursing? Because it offers powerful benefits at multiple levels for patients, for nurses, and for the healthcare system as a whole. First and foremost, EBP improves patient safety and quality of care. When we apply evidence that has been shown to reduce complications, shorten hospital stays, or improve symptom management, we make care safer and more effective for those we serve. Second, EBP encourages professional growth and critical thinking. Nurses engaged in EBP become lifelong learners. They develop skills in questioning practice, appraising research, and integrating new knowledge. These are skills that elevate our nursing profession from task-oriented work to a reflective, scholarly discipline. Third, EBP helps us deliver cost-effective interventions. Healthcare resources are limited, and we must use them wisely. By focusing on interventions that have proven efficacy, we can reduce waste, avoid unnecessary procedures, and improve the efficiency of healthcare delivery. Finally, EBP fosters a culture of lifelong learning. The knowledge base of healthcare is constantly evolving. EBP teaches nurses to stay current, continuously seek out new evidence, and refine their practice. This is a mindset that benefits both our profession and the patients we serve. Nurses have a central role in ensuring that EBP becomes the standard of care and not the exception. This role extends across four key areas. First, we must stay updated with current research. In today's information-rich world, knowledge can become outdated quickly. Nurses must develop the habit of reading professional journals, attending conferences, and participating in continuing education to remain informed about new evidence. Next, we must apply evidence in clinical decisions. EBP is not an abstract concept. It must guide our daily actions. Whether selecting a wound dressing, managing pain, or educating a patient, our choices should be informed by the best available evidence and patient preference. Then, we must engage in EBP initiatives within our workplaces. This can include participating in practice improvement projects, joining interdisciplinary EBP committees, or contributing to data collection and evaluation efforts. Lastly, nurses must advocate for an EBP culture. This means encouraging peers and leadership to support EBP, helping to break down barriers to its implementation, and fostering an environment where inquiry and innovation are valued. When we nurses champion EBP at every level, from the bedside to the boardroom, they help create a healthcare system that is safer, smarter, and more responsive to patient needs. The EBP process follows a systematic, iterative cycle designed to guide us from clinical question to measurable improvement. Let us break it down step by step. First, we ask a clinical question. A well-constructed question defines the focus of our inquiry. The PICO format, or the patient and/or population, intervention, comparison, and outcome, is a proven tool for framing clinical questions that are clear and researchable. Second, we acquire the best evidence. This involves conducting a comprehensive literature review using databases like PubMed or the Cochrane Library. The goal is to gather high-quality evidence that directly address our question. Third, we appraise the evidence critically. Not all evidence is created equal. We must evaluate the validity, reliability, and applicability of the studies we find. This requires critical appraisal skills, and this is a core competency in EBP. Fourth, we apply the findings to clinical practice. Evidence must be translated into actionable changes in care. This requires considering the individual patient's preferences, the clinical setting, and the feasibility of implementing new interventions. Finally, we assess the outcomes. Did the change improve patient care? We must collect and analyze data to evaluate the impact of our EBP initiative. This closes the loop and ensures that our efforts results in meaningful improvements in practice. Importantly, EBP is not a one-time event. It is an ongoing cycle of questioning, learning, applying, and evaluating that keeps our practice aligned with the best available knowledge. For a brief discussion on evidence-based practice models, check this video.